got 2 more.
Back in full work mode, Dr. G reads the investigator's report for her next autopsy.
So, we have a sad case today.
The decedent is Isabel Foster, an 18-year-old just out of high school. An independent spirit and avid dancer, Isabel had her heart set on studying musical theater when she got to college in the fall. At the time of her death, however, she was still living at home with her parents, recovering from one of the most traumatic events in her life.
7 days earlier, she'd gone to the hospital complaining of some unusual vaginal bleeding, and they found out she was pregnant.
After taking a sonogram of her uterus, the doctor tells Isabel that her bleeding is from an early miscarriage, and that the embryo, just 7 weeks old, would soon pass naturally.
A couple days, they were just going to treat it conservatively, just watching her.
Shaken by the experience, Isabel goes home. After 2 more follow-up visits, her ordeal seems to be over. The doctor finds no evidence of the embryo. Then, just a day and a half later,
she's watching TV on the couch, she falls asleep, the family thinks she's just taking a nap.
But when they try to wake her up, she doesn't respond.
Ready? It's Frank.
Something is terribly wrong. Isabel's father immediately calls 911, and paramedics rush her to the emergency room. But it's too late.
And she's basically dead on arrival to the hospital.
Isabel's sudden death stuns her parents and fills Dr. G's mind with questions.
We have a young girl, late teens, that's dead on the couch. I mean, what could it be? Does it relate to the miscarriage at all?
Miscarriages occur in up to 20% of pregnancies and are often the body's natural mechanism of aborting an unhealthy baby. While often emotionally traumatic, miscarriages usually cause no physical problems. But on rare occasions, there are at least 2 complications that can be fatal and may have killed Isabel. One is if the bleeding doesn't stop.
If the pregnancy does not completely miscarry, if she has not completed the process, the patient can lose a significant amount of blood. And that tends to be the most common complication that we'll see.
Another danger is if an infection takes hold and sends toxic bacteria into a woman's blood.
You always do have a small risk of infection because you have exposure of the organisms that are in the vagina to the uterus.
Isabel's full medical records could shed more light on the mystery, but they're held up at the hospital.
All we're getting is what the EMS told the hospital.
Did Isabel die as a result of a complication from the miscarriage? Could the death have been prevented? They are counting on Dr. G for answers. As Dr. G starts the external exam, she learns from the investigator's report that paramedics had made every effort to revive Isabel.
She has a lot of medical intervention. They really tried to save her life.
Her first task is to catalog and inspect each item of Isabel's clothing.
As we normally do in forensic, sometimes clothing can give us hints of what's going on.
If Isabel had continued to hemorrhage due to her miscarriage, Dr. G would expect to find bloodstains on Isabel's underwear or sanitary pad, but she finds nothing. It appears Isabel was not bleeding vaginally when she died.
So maybe the miscarriage, did we get the right story? Because I don't have her medical records yet. And, or maybe she's over the miscarriage, but she certainly didn't have any blood in her panties.
Next, as with all autopsies she performs, Dr. G examines Isabel's body from head to toe, searching for clues.
We didn't really expect to find anything. No, she looks like a normal, young woman.
But then, she notices something very subtle. Isabel's stomach feels slightly distended to the touch. Could this be some kind of fluid from an injury or undetected disease?
Could even just be changes in post-mortem. So it really is hard to tell what that little rounded abdomen is from.
The answers will have to wait until she opens Isabel's body.
Okay, did you take her ID picture? Mm-hmm. Okay, she's ready to go.
First, Dr. G makes the standard Y incision. When she folds back the skin and subcutaneous fat, she immediately sees what made Isabel's belly soft. And it's not just any fluid.
There you start to turn blue.
There's a major pool of blood in the abdominal cavity. Depending on size, the average human body contains about 4 liters of blood, which flows through the cardiovascular system, delivering oxygen to the vital organs. If more than 30% of Isabel's blood, about 1.2 liters, had drained into her abdomen, it would have been fatal.
And you're in shock because you just don't have enough blood in the vessels. It's all accumulating into your abdomen, and you die. Your heart doesn't get enough blood, and your brain doesn't get enough blood. They measure this blood in the...
To see how much blood Isabel has lost, Dr. G methodically removes it from her body.
We ladle it out with the soup ladle that we use, collect that, and measure it.
But I can't look where it's coming from until it's all out of there.
The total amount is shocking. A full 2 liters had drained out of Isabel's cardiovascular system.
So he's got...
Dr. G now knows what killed Isabel. The young girl bled to death internally.
That's clearly why she died. Now we've got to figure out why that's there.
A week after doctors told Isabel Foster she had suffered a miscarriage, the 18-year-old's parents found her unconscious on the couch, never to wake again.
This would not be something we would expect.
We see blood where it's not supposed to be here.
Dr. G now surveys Isabel's internal organs in situ, or in place.
She's just bled into her abdominal cavity. Organs like her brain or lungs, everything looks real pale.
Dr. G has discovered that Isabel lost half her blood through internal bleeding. But how? Often internal bleeding is caused by an injury to a major organ, such as the liver or spleen, or when blood vessels are diseased or torn by broken bones. But in Isabel's case, Dr. G suspects the hemorrhage could be related to the reported miscarriage.
This is abnormal.
The girl may have suffered complications from a follow-up procedure called a D&C, or dilation and curettage.
It's a common follow-up to a miscarriage to make sure all the products of conception are out of the uterine cavity.
In a D&C, the doctor scrapes out the lining of the uterus. Examining this lining can reveal why the miscarriage occurred. As minor as it is, however, a D&C is a surgical procedure, and up to 10% of cases result in complications, ranging from infections to trauma from the sharp instruments.
The most common risks with a D&C are perforation of the uterus. You could have injury to organs around the uterus, such as the ovaries, the tubes, the intestines. So it can result in disastrous consequences, even in the best of hands.
So,
without the full medical records, Dr. G can't know for sure whether Isabel had had a D&C. If she had, her massive blood loss could be from a serious puncture wound. To determine this, Dr. G homes in on Isabel's reproductive organs.
and you just gently lift up some of the small intestines and you can expose the uterus.
But the uterus appears intact. No perforations from a D&C. Instead, she finds the culprit just inches from the uterus.
Lo and behold, I mean, you can see quite readily where that bleeding is from. Clearly, we had about a 1.8 centimeter defect, a hole, right in the middle of the fallopian tube.
Fallopian tubes are thin conduits that carry a woman's eggs from her ovaries to her uterus. Somehow, Isabel's left tube has been torn open.
Okay, she's okay. Hold on.
Dr. G immediately realizes what must have caused the hole in Isabel's fallopian tube: an ectopic pregnancy.
An ectopic pregnancy is a pregnancy that has developed outside the uterus, outside its normal location.
A healthy pregnancy takes place in the uterus, where the baby has plenty of room to grow. But in up to 1 in 40 pregnancies, a fertilized egg on its way to the uterus gets stuck in the fallopian tube, either because it is too narrow or because of previous scarring from surgery or a sexually transmitted disease. There, the embryo implants itself, digging deeper into the tube as it grows. until the walls can no longer sustain the pregnancy and they rupture.
Now, a fallopian tube is very little. It does not have the capacity to expand to hold a baby like a uterus, and it just basically erodes right through it. Fallopian tubes can never hold a baby. They're doomed.
Let me know if it's enough, and I'll take her heart.
Despite the risk of a fatal rupture, however, ectopic pregnancies don't often end in death.
It's rare. We don't see these anymore.
That's because doctors can typically remove the embryo surgically to prevent the fallopian tube from bursting. But the hospital never diagnosed Isabel's ectopic pregnancy. Instead, they had supposedly observed and treated her for a normal uterine pregnancy and miscarriage. It's a puzzling contradiction.
Okay, we're going to cut the uterus off.
When she cuts open the organ, Dr. G makes a shocking discovery. The lining is still there, and there is no sign that an embryo was ever implanted.
We don't see anything to suggest a pregnancy.
The intact lining is proof that Isabel was not killed by a complication from a miscarriage, because she never had one. It also confirms that she never had a D&C, the follow-up procedure that would have warned doctors of her abnormal pregnancy.
I mean, if she had been diagnosed properly, she'd be alive.
Suddenly, explosive questions arise from this revelation. How could the hospital have made such an egregious error?
This is what killed her.
Dr. G wraps up Isabel Foster's autopsy, her mind already analyzing the findings. There's no doubt that the 18-year-old girl bled to death from a ruptured ectopic pregnancy.
The hole right in the middle of the fallopian tube.
But just a week ago, she had been diagnosed with a normal miscarriage.
She'd gone to the hospital complaining of some unusual vaginal bleeding.
So why didn't they catch her ectopic pregnancy?
You know, did we get the right story?
The intact uterus, the 2 liters of blood, the silent death. Now, after adding up all the clues from her investigation, Dr. G reconstructs what she believes were the likely events leading up to Isabel Foster's death. About a week before she dies, Isabel begins experiencing heavy abdominal cramps and vaginal bleeding. Concerned, she goes to the hospital, where an ultrasound shows no baby in her womb. Then, instead of exploring the possibility of an ectopic pregnancy, the doctor diagnoses a miscarriage.
I think what happened is they didn't find any evidence of pregnancy in the uterus and assumed she was having a miscarriage because of the bleeding. You know, that is one of the problems that this can mimic. It's not unusual for these women to bleed a little bit like a miscarriage.
The doctor's assumption is a crucial mistake. Convinced that Isabel is having a normal miscarriage, she apparently fails to conduct some critical tests, such as tracking hormone levels.
We want to know now, what is the level of pregnancy hormone? And is this a normally positioned pregnancy or an ectopic pregnancy?
In addition, for unknown reasons, the doctor also decides against doing a D&C. Without this follow-up, she doesn't realize that the pregnancy was never in the uterus, and Isabel's condition remains misdiagnosed. Within a few days, the cramping and bleeding subside, and Isabel believes her miscarriage is over. But in fact, the embryo is still there, inside her fallopian tube. It's been growing now for 7 weeks, stretching the tube beyond capacity.
When the tube expands, there may be some temporary relief of pain, which sometimes can be misinterpreted by the patient as everything getting better.
Instead, the danger only gets worse, until finally, the walls of the tube give way.
Then she bleeds out, and she bleeds out through the fallopian tube.
Half a liter, 1 liter, 1.5 liters. Undetected, the hemorrhage becomes fatal.
And the blood is spilling out from the hole. You're not getting enough blood to the brain, and eventually you pass out.
Right there on the couch, Isabel slips into shock. By the time her parents realize something is wrong, it's too late. She's lost too much blood, and she dies. Despite what appears to be a series of errors, Isabel's parents never bring charges against the doctor or the hospital.